Depression isn't always easy to recognize. It doesn't always look like sadness or crying. Many people live with it for months or even years without realizing what's going on. Depression can hide behind exhaustion, irritability, or even constant busyness. Understanding what depression really feels like and how it can show up in your daily life is the first step toward recognizing it and few key parts: how it feels emotionally, how it affects your thoughts, your body, your behavior, and your relationships. 1. Emotional signs. Depression often starts as a heavy, dull feeling that you can't quite explain. You might notice you don't enjoy the things that once made you happy: music, food, hobbies, or time with friends. It's not that you don't want to enjoy them, it's that you can't. The pleasure, excitement, or motivation that used to come naturally seems to fade away. Some people describe it as feeling numb rather than sad. Others say it feels like a constant emotional weight pressing on them. You might wake up feeling fine, then suddenly feel drained or hopeless for no clear reason. Mood swings, tears without warning, or a sense that you're disconnected from everything around you are all common emotional experiences in depression. 2. Mental and cognitive signs. Depression also affects how you think. Your brain can become your own worst critic. You might notice your thoughts becoming more negative, harsh, or self-blaming. Things like, "I'm not good enough," or "what's the point?" start to repeat in your mind. It can also make decision-making hard. Even small tasks, like deciding what to eat or what clothes to wear, can feel overwhelming. You might have trouble focusing at work or forget things easily. It's not because you're lazy or careless. Depression literally slows down the brain's processing and concentration abilities. Over time, this constant mental fog can make you feel frustrated with yourself, feeding back into the depression. 3. Physical and body symptoms. Depression is not just emotional, it's physical too. You might feel tired all the time, even after sleeping 8 hours. Your body can feel heavy, your movements slower. Some people notice changes in appetite, either eating much less or a lot more than usual. Sleep patterns can flip too. You might have insomnia or find yourself sleeping all day. Physical pain can also appear without an obvious cause. Headaches, back pain, or stomach issues are common. This happens because depression changed the way the brain and body process pain signals and stress hormones for behavioral changes. Another big clue is how your habits and routines shift. You might start withdrawing from friends and family, canceling plans, or avoiding calls. Simple daily activities like showering, cleaning, or cooking can start to feel like climbing a mountain. You might find yourself procrastinating more or feeling frozen when you try to get things done. Even things you normally love doing can start to feel like obligations. This lack of motivation isn't a choice. It's one of the defining features of depression. 5. Social and relational effects. Depression often isolates people. You might feel misunderstood or worry that others will judge you if you open up. It can make relationships feel draining, even with people you love. Sometimes, depression causes irritability. You snap at others for small things or feel easily annoyed for no reason. This isn't because you've become a negative person. It's the way your emotional system responds when it's overloaded. You might also notice a loss of interest in intimacy or connection. Even affection can feel distant. This can create guilt, which in turn deepens the sadness. Another painful cycle depression creates. 6. When to seek help. If these symptoms sound familiar and have lasted more than 2 weeks, it's time to reach out for help. Depression is not a sign of weakness. It's a medical condition that responds to treatment. A primary care doctor can run basic tests to rule out other causes like thyroid issues or vitamin deficiencies. And a mental health professional can help you understand the emotional side. Treatments might include therapy, medication, or lifestyle changes like structured sleep, exercise, and mindfulness. Many people start to feel better after taking that first step toward help. 7. Final thoughts. Depression is one of the most misunderstood conditions because it often hides behind a normal-looking life. You can be functioning, working, smiling in photos, and still be deeply depressed inside. What matters is not how your life looks from the outside, but how you feel living it. If you've been feeling persistently down, empty, or disconnected from yourself and others, you don't have to go through it alone. Help is available, and with time, the fog